A very common question: is OET easier than IELTS? While some suggest that Occupational English Test, OET, might be easier than International English Language Testing System IELTS due to its medical-specific content and relevance for healthcare professionals. It is essential to understand that both exams demand a similar level of English proficiency. The perceived difficulty of either test largely depends on an individual's background and experience. For those in healthcare who are accustomed to communicating in English within medical contexts, the OET may feel more straightforward as it aligns closely with their daily tasks and responsibilities. This alignment can improve focus and attention, increasing the likelihood of success. Ultimately, choosing between OET and IELTS should be based on which exam best suits your professional needs and language skills. To really know if OET is easier than IELTS, let's look at the key differences. Understanding the OET. The OET is specifically designed for healthcare professionals. There are 4 subtests: listening, reading, writing and speaking, tailored to medical contexts. For example, listening. Tasks involve understanding patient consultations and health-related presentations. Reading includes comprehending medical texts, such as journal articles and patient case notes. Writing requires writing referral letters or discharge summaries based on case notes. Speaking consists of role plays simulating real-life interactions with patients or colleagues. Understanding the IELTS. The IELTS assesses general English proficiency and is divided into 2 versions: academic and general training. The academic version is often required for higher education and professional registration, while general training is typically for migration purposes. The 4 subtests, listening, reading, writing, and speaking, cover a wide range of topics. Listening involves conversations and monologues from various contexts, not limited to healthcare. Reading includes articles, advertisements, and diagrams from newspapers and magazines. Writing requires writing essays or letters on a variety of topics. Speaking consists of a face-to-face interview covering everyday topics and general opinions. Key differences. 1. Relevance to profession. OET, directly relevant to medical professionals, focusing on workplace scenarios. IELTS, more general, covering a broad range of topics not specific to any profession. 2. Content familiarity. OET uses medical vocabulary and scenarios that healthcare professionals encounter daily. IELTS uses a wider array of topics, which may be less familiar to medical professionals. 3. Purpose. OET, for healthcare professionals seeking registration or employment in English-speaking countries. IELTS, widely accepted for education, migration and professional registration. Conclusion. So, is OET easier than IELTS? The difficulty of the Occupational English Test, OET, compared to the International English Language Testing System, IELTS, largely depends on your background and profession. The OET is tailored specifically for healthcare professionals, incorporating medical scenarios and terminology that are familiar to those in the field, which can make the test seem more relevant and approachable. In contrast, IELTS is a general English proficiency exam used for various purposes such as university admissions and immigration. It covers a wide range of topics that may be less familiar to some test takers, potentially making it feel more challenging. Ultimately, neither test is inherently easier, it really depends on your strengths and familiarity with the material. For healthcare professionals, the OET may feel more suitable and manageable, while the IELTS could be the better option for those seeking broader opportunities. Feel free to join the Swoosh English free OET Fast Pass Masterclass to discover the do's and don'ts of OET preparation, exam preparation tips on all subsection, and find out the #1 reason why students take their exam multiple times.